Yeah, so hello everyone and welcome back to Team Mars MasterAdvisor series for September 24th. This is a special edition of the series and I'm very excited about it. But first, I do want to rush us through some announcements before we kick off. First, I want to announce that next week we're going to welcome Luann and Melissa Lascelle from Lascelle Travel to talk about running a family-owned business. They are a mother-daughter team who's helped grow Lascelle Travel into a major agency, and I'm very excited to hear what they have to say about building a business while having that family relationship. I know there's a lot of family-owned agencies in our industry and a lot of family teams, and I can't wait to hear their perspective about that dynamic, along with some other general tips and guidance for how to grow a successful business. As always, we'll send out the link to get registered once we've wrapped up here with Dr. Grayver today. And I also want to say thank you for all who attended last week's talk on service fees with Jamie Jones and Tiffany Hines. That was one of our most popular sessions ever. And I know there's a lot of you new here and other people who haven't been able to catch that session. So I'm going to drop the YouTube link to our YouTube channel in the chat now for anyone who wants to rewatch that session or Jamie and Tiffany's first session with us. They're all sort of posted there. And you can subscribe if you want notifications when we do upload a new session. They're also all hosted on Travel Market Report's training page as well. As always, the chat is open, so any questions and comments, go ahead and drop them in there. This one, I think, will be particularly valuable for community feedback, and as a lot of advisors are in the same situation. So please don't be shy, drop any helpful tips, comments, or questions in there, and we'll get to them as we go along. And I see a lot of people asking about the recording of the sessions, and all these sessions are recorded again on the YouTube link. You can access all of our videos there. So today, usually we have a travel advisor on these series to give us tips about growing business, but today is going to be a special session. It's going to be something a little different. Today, we're going to talk about mental health and well-being. Throughout COVID-19, we've heard about how this period in the travel industry was being compared to a lot of other crises that we faced, to 9/11, to the financial crisis, to other major world events. But I think we've all sort of realized that this is something in itself. It's something completely unique and completely different that none of us have really ever encountered full on before. We've held sessions throughout the crisis to try to help you build your business, but we haven't really directly tried to tackle more internal personal problems that I know a lot of people in the travel advisor community are going through. So we want to do something special. Instead of the advisor, we're happy today to welcome Dr. Evelina Grayver to the session to talk about mental health and wellness. Dr. Grayver is a cardiologist with Northwell Health in New York. She's been a guest on CNN and other news network stations, and she has been on the front line of dealing with COVID-19 in New York. And I just want to say welcome to Dr. Grayver, and I want to say thank you so much for taking your time to talk to us today.
Oh my God, it's my absolute and utter pleasure. Thank you so much for having me here. And it is definitely a very unique type of an audience for me, but I'm hoping the fact that this could be helpful to everyone. I think that I want to start off by kind of telling everyone a little bit about my story, and especially during the whole COVID-19 era and everything else. So March 17th, I was a cardiologist at Northwell University Hospital. I'm the director of the cardiac care intensive care unit. And that day, the administration came up to me and said that, you know, Evelina, probably by the end of the week or maybe next week, you might have to help us out with some COVID patients. To which I said, okay, not really knowing exactly what I was getting into. But as you know, you never say no to administration. So I said, okay. And that okay came to fruition within less than 24 hours. In less than 24 hours, we became a massive COVID center at Northwell University Hospital, and I became one of the directors of one of the intensive care units for COVID patients. It was, you know, at times I sometimes tell people that I felt like I was at a sports bar playing darts, really kind of throwing at these patients anything and everything that I can potentially think of, because we had absolutely no direction. We had no idea what we were doing, and we were just trying our best to keep everyone alive as much as we possibly could. That idea of not knowing what you're doing, not knowing how you can potentially hurt someone, harm someone, it was nauseating to me. So that was the professional component of me. At the same time, on the personal side, because COVID doesn't affect us only one side, it's just professionally. It affects us personally and professionally. Personally, at the same time, both of my parents got incredibly sick. And I pretty much set my own mini ICU in the comfort of their living room. I set up cameras and certain oxygen capacity for them because at that point I already knew that if, God forbid, either one of them ever landed in the hospital, it may not be of benefit to them. And at the same time, I have a 13-year-old daughter who was home alone at the same time, trying to deal with her own fears of what's going to happen to mommy, fears of what's going to happen to grandma and grandpa. And this really hit hard for everyone, right? So professionally, I had no idea what in the world we were doing. Personally, I had no clue what would happen with my parents, nor did I have any clue as to what's going to happen with my 13-year-old child. I was doing anywhere from 16 to 18-hour shifts in the hospital running the ICUs because we just kept on getting bigger and bigger and bigger, okay? And lo and behold, in the midst of all of it, my grandfather gets sick, who was 99 years old, a Holocaust survivor, and unfortunately he did not make it. So, incredible amount of personal loss that was very painful. So, when everybody sort of asks, how did you do during COVID and how did you cope and what was your coping mechanisms and how did you make it and, you know, how is it that you're still smiling? I think that we are all dealing with significant amount of uncertainty and loss at this period of time. Whether or not that loss is professional or personal, it's real. It is significantly, significantly real. So how did I cope with this? I ran a lot. I ran a little, maybe too much because my knees are really feeling it now. But that was my method of coping. Physical activity. To me, that was the only way that I could potentially clear my head. And yes, was it comfortable running with a mask? Absolutely not. But I needed that, whether or not it was a 30 minutes, just a quick jog outside, I needed that desperately.
Yeah.
Go ahead, Dan. Were you going to say something?
Yeah, well, I know there was a message in the chat about sound. I just want to say the sound is good right now. So if anyone's struggling with volume, it might be on your end. I also want to say that we have a lot of messages in the chat saying they're sorry to hear about your loss, Evelina,
Thank
and
you.
everyone supporting you. I know, I mean, a lot of advisors, a lot of the people in the trade who have suffered professionally aren't in those life and death situations like you were. And I think hearing your story does help to put a lot of things in perspective. And your stress is obviously on a different level and different kind of stress than a lot of people in the trade are feeling right now. So yeah, I mean, I think it is valuable to hear how you've coped with your kind of stress and the mental toll that being on the front lines has taken on you.
Thank you. The interesting part about it is in the midst of all of this, I kind of began to feel that I was literally reliving the movie The Groundhog Day every single day. Every single day was the same to me. I would get up at the same hour. I would try to do either a spinning class at home or go for a very early run. I would put my hair in the same way, in the ponytail and the bun, because they told us the fact that the hair should be kept away. I would wear scrubs and certain shoes that I would then change when I get to work. I would go through the work as if it was just like on autopilot, and I would come home, get undressed before even walking through the doors so that I can jump into the shower, wash up, and then go in for a hug with my child. That went on and on and on. And then at a certain point, you're thinking, my God, like, when is this going to stop? And then there's always that small little glimmer of hope. And I know that everybody always talks about, hoping and the fact that it'll get back to normalcy. I think that, and I have a huge pet peeve right now with the whole terminology of normalcy, is because normalcy right now is what you make of it, okay? Trying to think and living in the past of what it was, what I could be doing now, anything else, that will do absolutely nothing for you, but just create significant amount more anxiety and depression, actually, for that matter. So in the midst of all of those Groundhog Days that kept on going and going and going, all of a sudden I get a promotion. I get a promotion to be the director of women's heart health for North Shore, LIJ, and the entire Cats Women's Institute. And it literally came out of, not that it didn't come out of nowhere, it was, hard work and dedication, everything that everyone usually puts in before some sort of a promotion. But you would think, how in the midst of all of this can people actually think of things like a promotion? But you know what? You grab onto anything and anything bright, anything shiny and pink and sparkly, and you just run with it. And you run with that positive inspiration and everything else. And that gave me an incentive to actually start planning ahead. I know that right now it's hard for us to plan anything. And, the big party line right now is you live in the moment, right? You live for today because no one knows what's going to happen tomorrow, which has always been the go-to line. But I think right now people kind of feel it more than anything else because it's hard for us to plan, especially when it comes to the world of traveling, right? Because I will tell you myself personally, that come September, when my child would go back to school, and that's another topic to begin with, I would start planning. I would start planning towards our Thanksgiving break. I would start planning towards our December Christmas break. Where are we going? I would call my wonderful handy friends like Anne Marie and the Mazza families and help and ask and beg, where should we be going? What's the fun place to go to? We can't do that at this point. We can't plan that far ahead. And that makes all of us sad, which is completely and utterly normal. But getting that promotion allowed me to plan for something, allowed me to try to create a program for women with heart disease, for cardio-obstetric component, cardio-oncology component for women, that would really allow me to target my energy towards something positive. And that was key for me. So finding that something that will give you that sort of kind of positive feedback, not only with physical activity, which will give you all of those good positive endorphins and everything else, but with something that you can really kind of invest yourself into. That's more than just something tangible or anything of that nature, because those kind of things, they go away. And creating mini projects always kind of helped for me. What I would always say, go ahead, Dan, you were saying something.
No, I mean, yeah, I mean, I want to go through sort of the tips that you started
Sure.
on. I want to take them one by one. I know we got a ton of questions coming in from attendees ahead of time that I think will prove pretty valuable to everyone in the audience today. But I mean, I guess you spoke about physical activity. You mentioned you like to run. I know there's a lot of different options for physical activity. And I know everyone has their own thing, but I mean, can you just talk about the importance of getting active in whatever way you can? And
right.
I mean, physically, mentally, how important is physical activity?
Okay, so when you're doing anything physically, you produce all of those happy hormones, the serotonins and the dopamines that really brighten up that mood of yours, especially if you're doing things outside. I can even tell you for myself, I feel totally different when I go for a half an hour run outside versus if I do an indoor spinning class. Not because of the fact that I'm not producing the same amount of endorphins. It's simply because of the fact that being outside in itself brings over a totally different type of an energy for me. So yes, running is a great physical activity. Spinning, everyone has their own limitations, obviously physically, right? Other people need more of restorative type of physical activity, like restorative yogas or Pilates, things that will sort of elongate and stretch their muscles, because that is when their muscles release those kind of hormones. So I think that, at a certain point, we get to know ourselves, our bodies, and we kind of know what works for us and what doesn't, whether or not it's physical activity or nutrition, which I'd like to talk about also.
Yeah, let's get into that. Let's get into nutrition too. You mentioned the other day, we didn't get into it, but you mentioned how important eating the right foods is and avoiding certain other foods can be
Absolutely.
getting you through out of a funk. And yeah, I mean, what advice would you have for people who are looking to improve their diet?
Stay away from heavy carbs.
Okay.
Just because everybody knows once they have that big loaded baked potatoes, all of a sudden they start to feel tired and fatigued, and they really wonder why that is. And that is because of the fact that that type of a heavy load is going to take away a lot of the blood flow from the rest of your body to try to digest, and you're just going to feel blah. I know that blah is not a scientific term nor a medical term, but I use it quite often in my practice.
Yeah.
So staying away from really heavy carbs would be of benefit. Also staying away from anything that is significantly caffeinated on a routine level, simply because of the fact that all you do is you create these sort of highs and lows, okay? You get to be very, very high and you feel like, oh my God, I have all this energy. I can do, I can move mountains. And then 2 seconds later, you're crash and burn, right? We've all had it. We've all done that, okay? So staying away from extremely caffeinated drinks would be of benefit. Keeping yourself insanely hydrated. Everybody, all of my patients always ask, like, doc, what does it mean to be insanely hydrated? Is it 6 cups? Is it 8 cups? There's no such thing. There's no measurement. My own staff, and I wish I could show you, just bought me this massive 4-liter bottle. I mean, it's literally like carrying a 10-pound child with you when it's fully filled, okay? Simply because of the fact that they think that I speak a lot about hydration, but I don't always do the right thing. But what is important about hydration is a matter of your urine output. And I know the fact that this is, a travel talk and we don't want to get into the yuckies of like urine output, but it's important that by 3-4 o'clock, okay, your urine is incredibly clear. Only then you have been incredibly well hydrated. So caffeinated drink, try to avoid. Keep yourself well hydrated. Stay away from heavy foods. Stay away from foods that also have a high glycemic index. And that's foods that are really sugary, and same thing, will get you up high and then drop you low, okay? So trying to find foods within sort of a low glycemic index, that will be of significant benefit.
Okay. I think those are great tips, and a lot of people have responded in the chat. I saw Elaine said she does her own yard work now, and it's helping her. It's helping her
Amazing.
quite a bit. Yeah, we have a lot of people really getting on behind the hydration too, which I think again is important. Nadia recommends yoga too, since she said,
Yoga is phenomenal because yoga will give you also not only that physical component, but also that mental, like it'll just stop things for a little bit. And meditation. A lot of my friends have been trying to really kind of recommend meditation, whether or not it's transcendental meditation or any other type of meditation. I have tried it multiple times. I've downloaded multiple apps too, the Calm app, all of these guided medication. I'm just one of those people that has a really hard time sitting still for more than 2 minutes. So,
yeah,
I am well aware of my own limitations, trust me.
Yeah, I mean, I think I'm probably in your camp too. Well, I did find I started doing yoga during quarantine with an app called Down Dog, and that I was really skeptical of it, but it was really easy to use, and it helped. And that's not an ad either. I think some apps are good. Again, you mentioned
Absolutely.
your limitations. Everyone has their limitations, and I think it's important to recognize that. We have a lot of questions specifically about travel.
Mm-hmm.
And I know you're not necessarily in the travel industry, but I'm hoping you can provide some context and some guidance, just as your opinion as an expert in the medical field. And one of them that came in during the week during registration was about returning to the workplace. What would you say to people who maybe work in an agency, maybe a small agency, and have some fear in the back of their minds about returning to their office after being away for so many months at a time?
Right. So I think that making sure the fact that you know who is in your office, making sure the fact that the office is fully cleaned before anyone goes in there, and definitely having a way to sort of monitor people, having them take a temperature when they walk into the office for the first day, understanding whether or not they've had recent travel history, whether or not they have any potential known exposure. I think would that would be a significant mental help, also trying to come back to some sort of a degree of a routine, something that is well known to us, and conforming it to these times, making sure the fact that you do maintain that social distancing between yourself and other people in the office, making sure the fact that your hands are clean at all period of times, that the mask is on if you're close to somebody, understanding the fact that I know the fact that there's been a lot of issues going back and forth regarding really the transmission of the virus. Is it respiratory? Is it airborne? What do we do with it? I think that kind of uncertainty coming from higher ups is sometimes very draining to people, and people don't even know what to believe, who to believe at that point. But in reference to returning to office space, as long as you know the fact that it is clean, you're maintaining social distancing, you're checking temperatures in the morning when people are walking into work, and then and asking the appropriate questions. And everybody is honest and respectful to everybody. So meaning if you're waking up in the morning and you're not feeling well, you're having some sort of a degree of body aches or cough or shortness of breath or nausea, not feeling well, definitely make sure the fact that you stay home and being respectful to yourself and to those around you.
Yeah. And I mean, so you mentioned you're in New York, and New York was maybe it was probably the hardest hit area of
Yep.
the U.S. during this whole thing.
Mm-hmm.
And I'm in New York too, and I know it was a bit eerie in March and April with the lack of people and activity on the street and things like
Yep.
that. Can you talk about now though? Like, I know, again, putting this in context, New York is a bit more active now, but a lot of advisors have clients who are maybe afraid of going anywhere unfamiliar to them right now. But you mentioned the precautions to take. If people do take the proper precautions, the social distancing, the mask wearing, the sanitation, the washing of hands, things like that, how big of a risk is COVID going out in general right now?
So I will tell you that at this period of time, and I can't speak because I haven't been following the data on transmission in all other states, but I can tell you that the transmission rate in New York is low. Yes, as of recent, within the week or so, we've seen a very small uptake, but incredibly minimal. Now, I can speak from my institution and my hospital alone, where I work in a 750-bed unit. 750 beds, right, for the hospital. It was extended up to 975 during the time of COVID, and it was all COVID, to now where we literally just have no more than 2 patients in the entire hospital. So I don't know whether or not those numbers kind of give you sort of an understanding, but I think just like you mentioned, that if people are taking the appropriate precautions, then it is safe to go out and enjoy whatever we can right now in New York. I know that we're hopefully going to have some indoor sitting in the restaurants September 30th, but only at 25%. So it's all right.
Yeah, and so let's talk about travel specifically right now. Right before we were on the call, you mentioned the importance of travel for some people and for their mental well-being. And I know there's conversations in the travel trade now about travel shaming, about people going on a trip and posting on social media and getting some negative feedback from their colleagues about traveling in this time. But
Right.
can you just talk about how important travel is for certain people who have been doing it? And for certain people, what does travel provide for them mentally and I guess psychologically, that kind of break they get from expanding their horizons and from maybe being in a new environment?
Well, so as everyone knows, I'm not in travel, but to me and to so much literature that has been posted in the past, traveling is the ultimate mental release. right? It is the ultimate sort of, you're taking away a break from your routine. You're putting yourself in a place that is unusual, that is different. You're interacting with different people. You have different experiences. That in itself is so enlightening. It's so inspiring, and it's so motivating that it lifts up your mental health significantly. Now, the whole idea of this whole shaming, travel shame, and everything else, there's two components to it. One is that people right now, and especially, and social media is great, but social media is atrocious also, because it creates significant amount of anxiety for those people that suffer from the fear of missing out, right? FOMO, that's the term that all the cool kids use, right? So when people look at those images, a lot of it is sort of like, wow, I wish I was there. Wow, I wish I could travel. Wow, I wish my state would allow me to travel. Wow, I wish that I didn't have the fear of traveling. A lot of people have the fear of traveling simply because of that they don't know enough of terminology. So I'll tell you from my own personal experience. I live in New York, and so does majority of my family. My brother, who's my only other sibling, lives in West Hollywood, LA. Now, with all of this personal loss that we had, with my grandfather passing away, my parents both been sick, during that height of the disease, he could not travel, and he felt unbelievably lost. But then within the last month, I really gave them the appropriate precautions, how to travel, what to have on, how to protect himself, how to protect those around him. I think that the airlines have taken an incredible precaution in reference to making sure the fact that people feel safely when they travel. And my brother came home 3 weeks ago. And now when they finally lifted actually the quarantine from California, I can't wait to actually go to him. So I think that everything has to be put into perspective. I think that what happened, that we have sort of these two spectrums, right? We have a spectrum where people are just, covered still with an N95 mask and a surgical mask and the goggles and everything else. And that's one spectrum. And then there's the other spectrum where nobody is doing anything. And I think that's important to find that kind of that golden medium, is to understand that COVID is real. Okay. For me, it's very hard to swallow when people are telling me the fact that, oh, it's no big deal. It's a made up thing. It's a political ploy or whatever not. I don't particularly want to get into that, but I think that's incredibly important to actually really to find that medium that works for you.
Okay. Yeah, I think that's a great point. Something you touched upon when we opened the session was that when you first started getting in the trenches with COVID, there was a lot of uncertainty, and you felt like you were on Groundhog Day. You didn't know when it was going to end. And to a lesser extent, I feel like that's what a lot of advisors are dealing with now. They have a lot of uncertainty. They don't know when their full business is going to return. They don't know if they book a client on a vacation, if that client may even be able to take that vacation without a quarantine, or if there's any other issues with government rules and things like that. There's just so many things are changing right now. There's so much uncertainty about what's going to happen 3 months, 6 months, 9 months from now. Do you have any tips for that? I mean, just waking up and not knowing exactly where your energy should go. Do you have any tips about dealing with a certain level of uncertainty constantly in your everyday life?
The way that I've kind of been looking at it is really trying to focus on things that you can control and what you cannot, and realizing that that's it. I have no idea, right? My patients are coming up to me and they want to know when's their next follow-up visit should be. And to me, it's automatic to say, 3 to 6 months. But then I'm thinking, okay, 3 to 6 months, but does that mean that they're really going to be there? Is that going to be a possibility? I have no control over it. So that's part of it, right? It's just really being able to focus on what you can and cannot control. It's really as simple as that.
That is a great point. I think that's super valuable, especially now. We have a little bit of the session left. Again, if you have any questions, I see the chat sort of scrolling. If you have any questions for Dr. Grayver, please drop them in there and I'll pass them along. And again, we mentioned sort of the everyday thing, Evelina. What about how important is sleep for everyone? I know sometimes it's difficult to sleep when the stress levels go up. can you talk about the importance of sleep, and then do you have any tips about making it easier for you to sleep when you're being sort of staying up late at night thinking about things that, again, you might not have a control over?
Right. So, similar to hydration, how my unit brought me a bottle of water to drink, it's the same thing with sleep. Like, I can tell you how important it is to get at least 7 to 8 hours of sleep, because as a physician, that's what I'm supposed to teach you. But I can tell you this much: it is easier said than done when it comes to turning your brain off. So I actually use my physical activity to really kind of physically exhaust myself. So at least I know that I will be completely physically exhausted. Okay. And then the mental part of it, I realized the fact that Netflix is not always my best friend. Okay. Right? Because if I'm watching it and I'm watching one episode after another, and then they always leave you hanging and you want to see another episode, and you end up, and it's like, oh my God, it's midnight, 1 o'clock in the morning. What am I doing? So I actually started turning off all of my TVs and everything else at around 9:30. And whether or not my daughter and I are just talking or looking through old pictures or looking through old, something of that nature where our mind is not continuously being stimulated. I also kind of stopped watching the news late at night because that actually kept me up through the night.
Yeah, there's a lot of things that people are going to have to cut out. Caffeine and Netflix, I don't think people are going to be too happy about.
Sorry, guys.
It's probably it seems like it's for the best. Social media too, I think that was an earlier tip. I think it's important we had a couple sessions where we mentioned how important social media is to building your business. It was, and the rule was sort of 10 interactions, 10 minutes a day. But yeah, I do think there is a negative effect of staying on social media all day long.
Yep.
All right. So any questions, please drop them in the chat. I had some people talk about sort of building wellness groups and things like that. And I know you're not in travel, but I'm wondering, do you see any new trends in wellness that maybe? Yeah, go ahead. Sorry.
Huge. It's absolutely. I mean, right now, for the first time ever, even the medical world, because I've done webinars for the American Heart Association and the American College of Cardiology, where right now the mental health and the stress level of physician and the idea of a burnout rate is one of the biggest sort of components. So yes, I think adding wellness to travel is beyond key.
So we have a question from Nadia from the chat. She wants to know if you have any advice of what to do for when your anxiety reduces your appetite. She says she's been trying to go for walks every day. She gets enough sleep, but she's having trouble taking in something other than water for lunch every day. Do you have any tips for that?
So it's interesting, right? Anxiety can do one of two things. It's either like it literally puts your esophagus in complete lockdown where you can't swallow anything but the water, or you go on this emotional eating binge where people are coming into me right now with, COVID-20, which is the 20 pounds that they put on during the actual pandemic. So the one thing that I would say is the following. In order to try to maintain a little bit of your appetite is to have very sort of small, frequent meals. Trying to eat something little every several hours or so, that in itself will keep your metabolism going and burning and wanting more. And rather than potentially having that water, maybe supplementing that with like a protein shake. Nothing thick, because that's also going to be difficult, but something that is nutritious will give you that nutrition. So protein shake, some health juices, like a blend of acai bowl would also be helpful during that time.
What about the other? What about the other way? You mentioned people are going one of two ways: either no appetite or maybe stress eating. Do you have any tips for avoiding stress eating?
Yeah, go out for a run.
Okay. Yeah, exercise seems to be. I mean, I know a lot of people, especially in age ranges, like might struggle with exercise, but I think whatever you can do to get your heart rate going is good.
Right. So I think that, I mean, I've said it quickly regarding potentially going out for a run, but emotional eating is something that a lot of people have struggled, whether or not there is a pandemic or there isn't, and they're kind of trying to feed whatever it is that hurts inside or whatever that anxiety really is, to trying to actually be more attentive to that. And whenever they feel like they're hungry and they need to get something to eat, before eating, taking a gulp of like half a bottle of water and seeing whether or not that potentially satisfies that hunger, and seeing as to whether or not at that point they might not have to eat at that point.
Yeah, I think that is great advice. You mentioned that you were talking to the American Medical Association about burnout. I'm
Yes.
just curious. I mean, I know a lot of advisors, the business has gone down, so maybe they're not burnt out from working too much, but they might be burnt out from having that Groundhog Day experience. Do you have any tips? I'm curious what you told the doctors, and if any of that is applicable to these child advisors about specifically about burnout.
So burnout is really exactly everything that I've mentioned to you before. It is sort of the fear of loss, right? Because for us as physicians, especially during the time of the pandemic, they took already a significantly overworked group of people, and then covered us a little bit more with the pandemic, right? So it's kind of like an empty well, and they drained it even more at that point, right?
Yeah.
So at this point, they really are watching the amount of hours that we're kind of working, how we're working, the kind of exposure that we're having. Are we taking our dedicated time off? How are we spending it? So, and also the hospitals have now actually formed certain groups, as support groups, to allow for that help. So I think that one of the things that I would always sort of recommend is that honestly seek that support, right? Whether or not it's from your loved ones, for your friends, or professional support. Like I mentioned before, at this period of time, every one of us kind of understands what it is that we feel when we're anxious or depressed or saddened. If we have that loved one that we can confide in, great. If we need a professional, wonderful. There's no shame in either.
Yeah, I think that's great advice too. And again, I've spoken about the travel advisor community a number of times on these sessions of how close knit of a community is. And my advice would be to reach out to your colleagues, not just for business tips, but for mental health breaks and for advice on how to deal with the stress and things like that. So we have about 5 minutes left with Dr. Grayver. Please, I would love to take one or two more questions if you guys want to drop them in the chat. But I do want to say, Dr. Grayver, thank you so much for stopping by today. And I know I can see you're at your office at North Shore. But I know your time is valuable too, and I want to say thank you so much for taking the time.
It's my pleasure. Thank you guys. Thank you guys for having me. I know this is a different sort of interview that you guys have, but I genuinely appreciate and love being here for you guys.
So let me grab one more. We have a lot of thank yous coming in too, which is great to see. But I guess in general, your tips seem to be watch your diet, watch your caffeine intake, get active, and just worry about the things you can control, and whatever's out of your hands is out of your hands.
And create your own new routine, right? Create your new routine. You know, I don't want to say throw away the idea of normalcy, but create your own new routine.
Yeah, I mean, that again, you mentioned that word normal, and a lot of it gets thrown around here. But one of the probably major events in the travel industry was 9/11, and I know that around that time there was definitely a lot of talk of returning to normal, and things never really returned to normal in travel after 9/11. A lot of it did, but I mean, some things are here to stay, and I think the same thing is with COVID. So accepting that, I think, is important.
Got it.
So for anyone who jumped in sort of halfway through this session, we're gonna get the link up on YouTube later today, and then we'll have it in our newsletter tomorrow. I want to say thank you to everyone who attended today. I know it's a different topic for us, but I think it is valuable, and I hope you guys got some stuff out of it. I do also want to remind everyone that we announced the Maestro series a few weeks ago, and just get ready. We're gonna officially launch that next month, October 1. So please keep your eye out for that. But again, thank you so much, Dr. Grayver.
My pleasure.
Maybe we'll have you back someday, but I want to say thank you so much for your time, and I hope to see everyone back here next week to talk family business. Hope everyone has a great weekend and the rest of your week.
Thank you.
Thank you.